Hi, my name is Karen Vicari. I'm the Policy Director for Access California, and I'm going to give you a 2020 policy update. I'm going to start with key legislation from this year, and the big one, the one we've been waiting for, SB 803 from Senator Bell. This is our state's fourth attempt at statewide peer certification. I'm sure you're all pretty familiar with it by now. It would create statewide peer certification and Medi-Cal billing codes, define peer support, create an actual peer support program in California. It was recently amended. It has failed every year because of opposition from DHCS, the Department of Healthcare Services, who would be overseeing it. So this year, they were hoping to get over some of those objections, and they amended it to make it optional for the counties. This is because 2011 realignment Proposition 30 mandates that if the state puts any new mandates on the counties, that the money from that has to come from the general fund. So the sponsors figured, well, if we make it optional for the counties, then there won't be an additional general fund. So that it limits the bill. It's not ideal, but they were really hoping that that would gather enough support to get the bill passed. But DHCS is still opposed. So we're pretty sure that the bill is going to get out of the legislature again. But we're not so sure that the governor is going to sign it. There will be a campaign going on. What you can do, what can you do if you're an advocate or you're in the county or you're just an individual? Number one, if you have lived experience, join our peer advocacy coalition, Peer Voices of California. It's on our website, it's easy to join. Everything will be going through there. All of the campaigns that we have will be going through there. Many of them will also be going through our regular email address, but the Peer Voices gets more specific advocacy opportunities. And stay tuned. There's going to be meetings of the sponsors, and they're going to come up with a full advocacy campaign. We want to, assuming it passes the legislature again, a big letter writing campaign to the governor to explain to him why peer support certification in California is so important. So stay tuned for that one, and keep your fingers crossed also, please. The other big bill we're working on is SB 665 from Senator Umberg. And this one would allow Mental Health Services Act money to be used to provide mental health services to people in jails. So we get a lot of questions on this one, and I want to make it very clear that we're not opposed to people in jails receiving appropriate services. We just really don't believe that MHSA money is the money that should be used for those services, right? MHSA was intended for community-based services. It was intended to prevent criminal justice involvement. And so if we're going to move the money into the jails, then that's not many more people at the county level who are not going to be able to get services. So there's been a huge coalition effort to oppose this bill. I think most of the big mental health groups at the state level are opposing the bill. And I guess the only good news is it started out as we think using CSS money, which is a bigger pot of MHSA money. The authors have been sort of forced by the opposition to limit the bill. Now it is going to be up to 8 pilot projects using innovation money to create pilot projects to see if they can use this money effectively within the jails. It arose out of Orange County, so we're pretty sure Orange County is going to be one of the pilots. We have heard maybe Sonoma, I don't know. I don't know who the other 6 counties will be. But this bill, even with all of the opposition, and we're still fighting it, but it kind of looks like this one's gonna get through. So what can you do? If you have lived experience, join our peer advocacy coalition. Stay tuned. Again, if it passes a legislature, which like I said, it looks like it's going to, there will be a letter writing campaign on this one too, asking the governor not to sign it. And if it does get signed, then it becomes a county advocacy issue. So just be aware it might show up in your counties. It's still MHSA money. So it still has to go through the stakeholder process. And the best thing you can do is just be informed and look out for it. If your county tries to pass a pilot project and you are opposed, get involved, get other people involved. Let your county know that you want your MHSA money to stay in your county. AB 1976. This is another one. Access is opposed to this one. Access is opposed to all efforts to expand involuntary services. We really believe that consumers have the right to make decisions about their own services and their own treatment and their own care. This bill would mandate that the counties enact Lohr's Law. They could opt out by a resolution, but the default right now they have to opt in. This one would make it so they have to opt out. And you know, when we're opposed to this one because it's involuntary treatment again. But this one, I'll go into the reasoning a little bit later, but this one we also think is likely to pass and likely to get signed by the governor. What can you do? Well, you can join our peer advocacy coalition. And again, if this bill passes and gets signed, it's a county advocacy issue. So if you are an advocate in a county or you're in a county, then just know that it's an option to have your county opt out. And if you're a consumer, let your county know that consumers oppose all forms of involuntary treatment. Other bills that we're following of interest, AB 2112 from Assemblymember Ramos. This one would create a state office of suicide prevention. This one looks likely to go through. There's actually money allocated to this Office of Suicide Prevention in the budget. So this would be a good one. It would create a state office that's going to look at the causes of suicide, the frequency of suicide, and come up with ideas to prevent suicide. SB 855. This one is it's an insurance bill. It's not a public mental health system bill, but it strengthens California's parity laws. It requires coverage for medically necessary treatment of mental health and substance use disorders. And we already have parity, but it's limited to a specific number of conditions, where this new bill expands it to anything that's in the DSM. And this expands parity to substance use disorders. So normally Access, we operate pretty much within the public mental health system. That's our focus. So why do we care about an insurance bill? Well, because people aren't getting appropriate services in insurance plans. And if they don't get appropriate services in insurance plans, what happens? They degrade, right? They can't keep a job and they end up in the public mental health system. So if insurance companies can really be required to up their game and provide really good services for us, then that's going to take some of the strain off of the public mental health system. And it's just going to make all of our lives better, right? SB 1259. This one is for board and cares. This one would create a task force that would issue recommendations on how to meet housing and care needs of SSI recipients. And, you know, I actually don't know if this one's likely to go through or not. I hope so. it focuses on the homelessness issue of the elderly. They're an increasingly more frequently homeless group of people. So this bill, I think could be good. It doesn't specifically address the problems that are going on in boarding cares, but my hope is that if the bill gets passed, then this task force could be requested to really look into improving boarding cares, not just increasing the numbers of them. And AB 2164, this one increases telehealth for FQHCs, federally qualified health centers, and rural health centers. So this one just sort of fills a strange gap in how those centers can establish a new patient, but still very important, especially now, right, when there's so much telehealth going on. So that's it for the legislation. The state policy update. Wow, a lot went on this year in state policy. Updates to the MHSA. This is what the state is calling the MHSA refresh. But as a group, as a coalition, we decided that that sounds too good. Sounds too positive, right? Let's just call it what it is. Updates to the MHSA or changes to the MHSA. Last year, we got wind that the state was planning to rewrite the MHSA to focus on 3 priority populations, homelessness, criminal justice, and children, which may be good, may not be good. We don't know because it was all being done at the Steinberg Institute behind closed doors. There was no communication about what they were planning. And we all know the MHSA was written to provide for unprecedented levels of client involvement, right? And stakeholder involvement. Yet here they are making changes to the MHSA with no stakeholder involvement. So there was a legislative hearing that the legislature sort of reluctantly invited CalVoices to. And it was really cool. It was really cool because of all of you. So what happened was they invited CalVoices or Access to testify. And I was the one that was testifying, and they said, the MHSA refresh is gonna go ahead as planned. So don't oppose it. What you need to do is just tell us what you like about it or what you don't like about it. Well, at that point, Access was opposed to it because we didn't know what was going on and we couldn't support something that was going on behind closed doors. So anyone who saw it knows I was so nervous because, you know, when you get up and testify in front of the legislature, you're supposed to play nice in the sandbox. But I got up there and I just said, hey, you know, we're opposed to it. We think the MHSA can work if it's properly enforced. Enforcement is what has been lacking. And I will tell you, that room was full of consumers who came from all over the state to attend this hearing. And anyone who was there can remember, I was the last one to speak. And after I spoke, the whole room full of consumers just erupted in applause. And that's why I say here, advocacy works, because it wasn't what I said that changed began to change the dialogue. It was everybody in that room who came from all over the state, who lives with mental health conditions, who has lived experience, or family members with lived experience. It was all of you who you know, erupted in applause and lined up out the door to make comments supporting what Access said. That began to change the dialogue. So that advocacy works. That's my point here. Thank you to everyone who showed up, and keep showing up because it makes a difference. Your voices really made a difference on that one. So our message got heard, but not heard enough. Access had meetings at the legislature and we were told, no, it's going to go ahead, it's going to go ahead, but no one knew anything about it. So Access convened a meeting in March where we brought in some consumers and we brought in statewide advocacy organizations, and we formed a coalition that's creatively called the MHSA Coalition. Creativity is not my strong suit. But this coalition came up with a document called the MHSA Guiding Principles document. And that is, I haven't counted, there's probably 19 groups signed on to this document. And it lists all of the things that as a coalition, mental health organizations want to see preserved through any changes to the MHSA. And let me tell you, all of these documents are on our website if you want to reach them, accesscalifornia.org. So that guiding principles document also reached the administration. And at this point, we're pretty certain that future updates to the MHSA will be done in public and will be done with stakeholder input. So the coalition also resulted in some compromises with the counties, because the counties have wanted to, especially due to COVID-19, have wanted some flexibilities with the MHSA. So the coalition worked with the counties and came up with some compromises. You know, I think ideally we don't want MHSA flexibilities, but they were going to happen. And so we came up with some compromises that we could all live with. And these are just for COVID-19. They're only until July 1st, 2021. But what they do is they stop reversion for another year. Reversion was supposed to start this year, and it won't start until next year. It allows counties to postpone their 3-year plans for 1 year if they certify that they are having trouble getting a plan passed because of COVID-19. And it also allows counties to access their prudent reserves. And the last part of the MHSA refresh was the Little Hoover Commission. That's an independent state oversight agency that has written some reports on the MHSA in 2015 and 2016. And in response to something they heard, that the MHSA, the updates to the MHSA are still gonna happen when COVID is over, they released a blog post sort of reiterating their main concerns. And we were happy to see this because these are Access's concerns. These are the same things that Access would like to see from the MHSA. Stronger statewide oversight, more transparency of the funds and the data, like where's the money going, how much money is unspent. We need more transparency so that we know what's really going on. More accountability. We need to clarify in the enforcement. You know, DHCS enforces some, the OAC enforces some. So we really need to clarify enforcement. And Access would say we need to strengthen enforcement also. So the state can be held accountable for outcomes, so the counties are held accountable, right? So we know that our money is making a difference. And so we know that people are getting appropriate services and have access to really good programs. Increase public engagement, well, you know, that's a big one for us. And to replicate successful programs, which was the intent of the MHSA originally. It was based on the AB 34 and AB 2034 programs. So that's just a little bit of information. They have their full reports. You've probably seen them on the Little Hoover Commission website. But we were happy to know that the independent agency really is in line with the same concerns that we have. So what can you do? Well, you can join our Peer Advocacy Coalition. Stay tuned for advocacy alerts. This issue will come back as soon as things calm down from COVID-19. It's a high priority for the governor to make changes to the MHSA. Insist that the consumers are at the table. That's the most important message we can keep putting out there is bring us to the table. Like we have really important knowledge that we can share, and we have really important experiences that we can share. Nothing about us without us. So that's the most important thing you can do is just be aware and let people know, hey, you know, you can't change this act without including us. And share the MHSA principles, read them, know what they say, and know that there's a whole coalition of mental health organizations standing behind them. So another important report that came out recently, the California State Auditor's Office did an audit on the LPS Act. That's the Lanterman-Petrus Short Act. And that's the act that permits involuntary treatment, 5150 holds, conservatorships, all of that. So every year, year after year, there are bills to increase involuntary treatment. Usually expand the definition of gravely disabled. And this is in large part stemming from the homelessness problem. There seems to be a belief that if we can put more people into involuntary treatment, then we're going to end homelessness. And like I said, Access is always opposed to these efforts. So this audit came out, and everyone was a little curious about what it would say. It was a little bit scathing. It looked at 3 counties, LA, San Francisco, and Shasta County. And it did find that they do not agree, the state auditor does not agree that we should expand involuntary treatment, which was refreshing. They believed that expanding involuntary treatment could infringe on people's liberties. What they did find was that, and I think, you know, we could probably all agree with this, that there are not enough community-based services to take care of people, especially people exiting an involuntary hold. There's nowhere for them to go. And so that's really what the report focused on, was increasing the community-based services. The one thing that we weren't real happy to see, and this goes back to AB 1976, the state auditor did recommend that every county enact Laura's Law, which is why we're pretty sure that 1976 is going to go through. So that's just something to be aware of. What else happened this year? The big one, right? COVID-19. Wow, it kind of shook all of our worlds. It certainly shook up the policy world. It put a halt on everything. It shortened our legislative session. It just, wow. So from a policy perspective, what's COVID-19 doing? Well, it's increasing the need for mental health services. Not only due to people losing their jobs, is it increasing the number of people in Medi-Cal, but you know, we're stressed out. It's just increasing the need for mental health services for everyone. It also created a $54.3 billion state budget deficit, which is never good for the public mental health system. It caused a recession, which is decreasing county revenues, the same county revenues that they're using to provide services and programs. And the other big impact it had was people living in congregate environments are especially susceptible to acquiring the virus. You know, people in boarding cares, people in homeless shelters. We keep hearing about nursing homes having outbreaks, but who's tracking homeless shelters and who's tracking board and cares, and who's tracking inpatient hospitals. So that's been a big concern of ours through COVID-19. What we're doing. Well, we sent a letter to Governor Newsom and the administration asking them to track COVID-19 in congregate environments. We were partially successful. DHCS has started tracking COVID-19 in some inpatient hospitals. We're not quite sure how they're deciding which ones, but they do have a list on their website now where they're tracking COVID-19 in inpatient hospitals. We joined some coalition advocacy efforts to ensure that public mental health system funding isn't reduced. It was threatened. And when Governor Newsom first realized how big his budget deficit was going to be, he reduced funding for the public mental health system. I think we managed to get most of that maintained. This is general fund money. We got most of that maintained, but the counties are still going to be feeling the pinch from MHSA money will be going down because millionaires aren't making as much money as they were. And realignment will be going down. So there's still going to be some strain on the counties, and they're working hard. They're doing everything they can to make sure that services aren't cut. And then we're monitoring statewide policies. Whatever happens, we're always monitoring statewide policies to ensure that consumers can continue to receive necessary and appropriate services during the pandemic. On the horizon, so what's going to happen next year? What am I going to be talking about next year? Well, the big one, changes to the MHSA. I think those will come back up probably in time for the next legislative session, but no one knows for sure what's going to happen with the pandemic. But I am expecting to see those soon. And Medi-Cal, remember Medi-Cal was working on their CalAIM proposal to try to improve Medi-Cal with whole person care approaches and addressing the social determinants of health. So that I think will be coming back also. And there's always opportunities for people to get involved when CalAIM comes back. They have a lot of stakeholder meetings to talk about what Medi-Cal should look like. On the horizon, still ongoing reductions in county funding, which we will be monitoring just to make sure that key services are not cut or key programs are not cut. And I hope I'm not talking about statewide peer certification legislation again next year, but I might be. So let's keep our fingers crossed. Let's all send letters to the governor if SB 803 makes it through the legislature. And hopefully we'll be talking about creating our new peer certification program next year instead of just passing the legislation. That's all I have. Thank you so much for coming to our conference, and thank you for listening to me.